Hello everyone and welcome to Kikkawa College. And as always, we are going to focus on a variety of musculoskeletal and neurological techniques that we can add to our repertoire. Right now, we are going to be performing anterior glide of the glenohumeral joint with oscillation. Okay, so for this technique, which is useful in any case of adhesive capsulitis, which can develop as a result of any shoulder injury, we want to place the shoulder in a neutral position, which is approximately 20 degrees flexion and abduction. I'm going to get a grip of the humeral bone as close to the joint line as I can, and then I'm going to distract with a force of about 2 pounds. So I'm tractioning the shoulder right now. But as I sustain the traction, I'm going to apply circumduction favoring the anterior glide. Okay, so this is trying to break the adhesions, the intracapsular adhesions between the head of the humerus and the glenohumeral ligaments. So slowly, I'm applying the oscillation. We start at grade 2 with maybe 5 pounds of overpressure. However, we can actually, further in the treatment, we can increase the force to about 10 to 15 pounds and turn it into grade 3. So anterior glide with oscillation of the glenohumeral joint. We can do similar technique for the posterior glide. In this case, I'm going to distract the shoulder, press posteriorly, and apply the same type of scooping motion favoring the posterior part of the joint capsule. And again, we will continue for 20 to 30 seconds, communicating with the client about any potential pain and discomfort.